And one of the problems that we have with the autism diagnosis is that you have such a wide spectrum. You're going from geniuses in Silicon Valley to somebody who can't dress themselves when they're an adult. You know, it's all called the same thing. And that can be a real problem.
Yes, and we probably have parents whose children are on all ranges of those. Some who are just mildly,
right.
you know, they might, yeah.
But when they're little tiny kids,
please.
when they're 3 years old, can look really severe. And if you do a lot of early intervention, you can get them fully verbal. Some of them you can get fully verbal, others you can't.
And you talk a lot about one-on-one intervention, 20 hours a week of really direct, highly interpersonal. Do you want to add a little bit more, say a little bit more about that?
That's especially important for these little ones. You know, I'm talking about 3, 4-year-olds. And we got to keep them off the electronics. That needs to be limited to an hour a day. But they've got, you know, a lot of working on language, speak slowly to them. The other thing you've got to do is give the child time to respond. Even though they're not deaf, they oftentimes don't hear auditory detail. Like if I said table, they might hear able, or something like that. They're not hearing the hard consonant sounds. So you have to slow down when you talk to them. Also, wait and give the child time to respond. Some of these kids are like a phone on one bar. You've got to wait for it to download the web page.